Brachialis. ¿Tienes el... Sandra, bote de los... A ver. So, for example, now with the Brachialis, we will ask also the patient if he's feeling pain in the thumb or in this area or just here, okay? Try to put it here. Okay. Are you comfortable there?
Yeah.
So we are going to palpate the tendon. For example, here, if you want to use this, sometimes if I flatten the tissue a lot, I can reach the bone more or less. But if I'm here, we need a 4 centimeters needle, okay? So I can make a calculation, so I can say, okay, I'm palpating here, I'm clearly feeling a taut band there, so it's superficial, so I can do it with this. But if I'm here, you can see that I will need a longer needle, okay? So I'm going to try with this, because I can directly palpate a taut band, okay? So I'm going to say what I'm feeling, and then you tell me if you agree with me or not, okay? So I put this tendon a bit apart, okay? I move, I make some space. So for example, what about this taut band?
Not very much, but...
No? What about this? Not very bad? No? We are going to look for internal one. What about this?
Mm.
This is worst?
No.
This one?
Mm.
Okay. So we are going to fix this. We are going to make a bit of a space. We check. We are over the taut band. We fall. We are now over. We compress. And as usually here there are some nerves and I can't control, I'm going to do it very slow, and I ask him, okay, let me know if there are any electrical feeling or anything that is strange. Now there is a twitch, okay? So now what I can do is to give a bit of support in case he moves and say, okay, we are going to move,
Yeah.
twitch.
I think it's nerve. It's nerve.
Now there was a twitch there,
Yeah, but
but
it's very,
the
very...
other, okay. But there were twitches, so
Yeah. But comparing to other points, tender points, it's more painful.
did you feel refer pain here?
Not
Just
that
here,
much. Yeah, not that much.
but some or any at all?
Yeah, some.
Okay, so this is a good point, because if you are getting some refer pain in the area, you can say, well, here you don't have any problem because it only can be brachialis. But in other muscles, for example, with the extensor, there are a lot of muscles. Depending on the pain, the movement, you can say, oh, this muscle is worse, okay? So,
if you want to do the other side, the lateral side, you will do it on abduction, right? And you will sit.
well, in this case, as this is very flat, you just can take this a bit apart and move like this. The only thing is that sometimes the direction has to be a bit like this, because your fingers are palpating like this. So, considering the tendon, if we are medial, we give some inclination here. If we are lateral, some here. So, you can place in the other position, but here, as you don't need a lot of inclination, more or less you can do it. But this is up to you, how you feel more comfortable, okay? So, we are going to have a look now to the adductor pollicis and to the first dorsal interossei.